What's up, guys? What's up? What's going on? Let's do something today, okay? Let's do some work today. Today I want us to talk on nursing delegation, okay? So last week I started this topic, which I said we're going to be going through leadership and management, delegation, prioritization, um, response to emergencies. So today we're going to see nursing delegations, and I want you to stay with me from now to the end. Get a pen and paper. There's a lot for you to write down as we answer some questions. If you do not have time to read on this area of the Nclex, I beg you stay tuned to the end of this video. You're going to learn something very important, and you might just want to listen to this video over and over, and you don't have to read anything more on this topic again, unless you just need to do some revision. So let's get going. The first question we're going to see says, the nurse is caring for a newly admitted client diagnosed with lopsided CVA cardiovascular accident with expressive aphasia and right-sided weakness. When caring for this client, which intervention would the nurse delegate to the assistive personnel? You say assistive personnel or unlicensed assistive personnel, UAP. Okay, the first option says accompanying the client to the speech therapy. B says initiating passive range of motion exercises. C says begin educating the client on simple sign language phrases. D says turning and positioning the client every 2 hours. Okay. Which is the right answer? The right answer will be D. Okay. Turning and positioning the client every 2 hours. We're going to see, I'm going to give you the various responsibilities for an RN, an LPN, and an assistive personnel. Okay. Now, an AP or UAP, they are taught proper positioning skills. Although this activity should still be supervised, but this is the right thing to assign to this personnel. Now, why is A not important? It is not necessary to accompany the client to speech therapy. There is something we call rational delegation. Okay, you have your personnel in the unit. You must make sure that you don't overexhaust the personnel because they have work to do. You can just direct the client to the speech therapy department. You don't necessarily need somebody to accompany uh, the client to speech therapy. Okay, this will take the AP out of the unit and reducing available help should one comes up. Okay, now you will be informed. You should know that the AP can carry out passive range of motion exercise, but they cannot initiate. Okay, initiating anything of this is needs some nursing judgment. Okay, the nurse has to determine which uh, range of motion to which extent, and if there is some pain or some resistance in the muscles and so on. This is the work of the nurse because it requires some nursing judgment. You cannot give this initial activity to the AP. Educated. No, 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 no. First of all, when I answer a question when we're doing management and leadership, uh, when it comes to areas of organ donation, there are some areas in nursing that the nurse or the LPN is not skilled. You have to assign to the right person. So there are people, there are language speech therapists. You assign them to. You don't have to educate on. Don't the word simple should not deceive you. But this is not your activity, is not even the nursing activity. It is a speech therapist activity. So you don't have to do anything there. Let's use this question and revise everything as far as nursing delegation is concerned before we move to um, um, answering some questions. Now, what is nursing delegation? Nursing delegation is a process of transferring performance of a selected nursing task to a situation, in a situation, to an individual who is capable and has the authority to carry out this task. Okay, I take it over. The process of transferring performance of a selected nursing skill or nursing task in a situation to an individual who is competent and authorized and is capable of performing that specific task. Now, the nurse who is delegating has to maintain the accountability, the ultimate accountability. Though you are assigning somebody to do that, but you are also accountable. The person who has been the delegatee is also accountable. And there are some 5 important points we need to know when carrying out delegation. We call them the 5 rights of delegation. Please take a pen and paper and take down this note. You will need it. First, delegate the right task. What does that mean? The right task you are delegating should be within the scope of practice of the personnel you are delegating, the job description, the agency policy, procedures, and predictable outcome. 2, right circumstances. With the client stable, you should be able to delegate stable clients to somebody, okay, and you take care of the unstable ones, non-complex one, okay. 3, right person. The task I'm delegating is it to the right personnel within the competency and knowledge and skills of that personnel. You can take an LPN task and delegate to a UAP, right? 4, the right direction and communication. When you delegate, make sure you give clear instructions, specific outcomes. Okay, I want you to take care to go monitor the blood pressure of patient in bed 50. Tell me if the systolic blood pressure is more than 130. Be specific and make sure that the delegatee verbalizes understanding of what you have said before going on to carry the task. We call it loop communication. You've seen this in BLS. And the last and important point, right supervision and evaluation. You should make sure that you go and monitor the task if it has been perfectly performed, and you give appraisals and feedbacks to the delegatee to appraise he or she for the job well done. Let's look at the guidelines. They are just similar to the 5 rights of delegation, but before delegating, put in mind that the most important thing is the safety of the client. Be aware of the individual variations in work abilities that we're talking about the personnel you are delegating, the scope of practice, the job description, and the skills. Determine which task can be delegated and to whom. That's the same thing we're saying. Match the task to the delegate on the basis of the Nurse Practice Act. We'll talk about Nurse Practice Act over and over. Provide direction, clear, concise, accurate, and complete. Validate the delegatee's understanding of the direction. Loop communication. Communicate with confidence. Maintain a continuity of care as much as possible when assigning client care. This is very important. Now, let's look at the responsibilities of an RN. There's what we say, the RN cannot delegate what he or she can eat. EAT is standing for what you can evaluate, A, what you can access, and T, what you can teach. These activities should not be delegated to anybody. Okay. So, for example, examples I've given you here, compilation, various questions that I have gone through. When you find a question on delegation, you will see some of these examples that will keep appearing. That's why I'm telling you, get a pen and paper and take down notes in this area. Tasks that requires clinical judgment, you don't have to delegate. You take care of it. You understand this. Initial education, patient receiving blood admission, anything initial post-op vital signs, post-op ambulation, post-op feeding. You don't delegate. You, the understander, takes responsibility of this. Discharge education, formulating a nursing care plan, it is your responsibility. Collaborating with social service to develop a care plan, developing policies and psychological support are the responsibilities of a registered nurse. You don't delegate this. Let's see what can be delegated and what is the responsibility of a licensed practical nurse or what we call the licensed vocational nurse. They can do the following. They can attend to stable clients with expected outcomes, e.g., diabetes mellitus requiring change or change for a status ulcer. Yes, the LPN can carry out sterile dressing. Okay? They can carry out sterile dressing. They can patient with tube that require ambulation. They can do that. Colostomy care, ostomy care, irrigation, feeding, but they cannot provide post-op first feeding. Be careful. They can implement an already formulated nursing diagnosis, collect urine in a Foley catheter. Take care. In a Foley catheter, we're going to see where the nursing assistant or the UAP cannot do that. This is a sterile procedure. The LPN can do that. Administer oral medication, sub-Q, topical meds, antispasmodics. Monitor RN findings, reinforce education. They cannot initiate education. They cannot start education. Perform focus assessment. Take care of this word, focus assessment. Breath sounds, vowel sounds, they can use the stethoscope to do that. Yes, you might be questioning, what's that? But this, yes, this is under the scope of practice. They are trained to do that. Capillary refill, numbness, they can do. We call it focused assessment. They cannot start an IV. They cannot hang or mix IV meds, especially the push and push IV push meds. They cannot. They cannot, they can maintain an IV and document the flow. Get it? Let me clarify you. The IV has been initiated, has been started by the RN. They can maintain it and they can only document the flow. They cannot administer blood or deal with any central line, anything central line, they cannot. They cannot do anything first post-op. Please, it looks much here because it's like I said before, it's a compilation from different past questions, in test questions. You will see this word, you will see these sentences as you practice questions when it comes to delegation. Let's look at the AP or UAP. They can do the following. Standard unchangeable procedures, activities of daily living, bed bath, mouth care, clothes dressing, feeding, positioning change, housekeeping. They cannot do feeding, first feeding on a post-op patient. They cannot feed stroke patients 24 hours after admission. They can do that if it is 48 hours after. Okay, bed making, linen change, transfer, fracture patient on the leg. Okay, this patient or fracture of the femur, this patient, this is a 1 day post-op. Their outcomes are unchangeable. They can take care of this patient. Okay, they can take care of this patient. A right-side stroke patient who require assistance with bathing, they can. Routine or objective data, they can check the height, the weight, the vital signs, the pain scores on stable patients. So when you see the question, be careful. They can document the urine input and output and the vital signs, but they cannot document anything about the patient. They can only document what they have done. They go and they monitor the vital signs. They will put it in the medical record, but they cannot write anything about the patient in the medical records. They can give topical medication, OTC medication, but be careful. We have nitroglycerin topical medication, which they cannot give, or the ointments, because why? It's not an OTC medication. They can stop equipment, reinforce infection control, okay? apply abdominal binder, place or attach cardiac leads on a monitor. Yes, they can collect clean catch or midstream urine, but they cannot collect urine in a Foley. I told you this is a sterile procedure and it is the responsibility of the LPN can do that, not the AP. With this said, let's look at the second questions. Okay, let's proceed. The second question. So the second question says, a medical surgical nurse is assigned to work on the ops and gyne unit today. Which client will the charge nurse assign to the medical surgical nurse? Very important question. A client who has hysterectomy with sapingo oophorectomy 12 hours ago. A 24 weeks gestation client on bed rest for preterm labor prescribed a non-stress test. Non-stress test. I am from a medical surgical unit. A client who vaginally birthed a 2 pound, that's 907-gram fetal dismissed yesterday. 36 weeks gestation client newly diagnosed with gestational hypertension. Now, this area of assignment is talking about assigning the client from one unit to the other. And what I want you to understand is that when you are assigned to go work in another unit, first, the nurse should assign you stable clients. Second, the nurse should have in mind the type of conditions that you have come across in your unit and give conditions similar to that to you because you are new in this unit. So with this, what will be the right answer? A is the right answer. A client who has a hysterectomy with sapingo oophorectomy 12 hours ago, this is surgical removal of the ovaries, either one or both of them. This is a med-surg condition, and this nurse is able to take care because he's coming from the medical surgical units and he's used to medical such condition. But the other B, C, and D, these are ops and gyne conditions that this nurse has no idea about it. Not actually no idea. Is not capable of actually providing care. So this is what you put in mind. You might have come across question. They say they send a nurse to a pediatric unit. Look at the options. When you see an option that has what to do with the pediatric unit that this nurse is used to, this is the right thing that you're supposed to assign to. Secondly, if the stable condition, this nurse can adequately, appropriately handle this condition. And the unstable conditions that are about this unit should be handled by nurses of that unit. 3, the nurse manager can appropriately delegate which tasks to the unit charge nurse. This is nurse manager to the unit charge nurse. Remember, when I did the review on management and leadership, where we saw the interdisciplinary team members, the supervisor, the charge nurse, speech therapist, case manager, and I gave the function of a supervisor can call nurse manager, and we say they can delegate staffing to the charge nurse. The charge nurse takes care of the activities of the unit during that shift, of the nurses who are on that shift. Okay, so charge nurses can be as many as possible. Every shift might have, the charge nurse can go for day shift, there's another charge nurse for night shift, and this week it changes. So it takes care of nurses for that shift. A, determine the staff assignment for the upcoming shift. B, terminate the assistive personnel for insubordination. C, decide the salary for LPN following orientation. D, tell a staff nurse to initiate disciplinary action against a peer. What's the right answer? The right answer is A. Okay? The nurse manager or the nursing supervisor carries out the operation of the units, recruitment, finances and disciplinary and everything. The charge nurse is not has nothing to do with this administrative function. The nurse manager or nurse supervisor does scheduling, but she can delegate this task to the charge nurse to schedule for the next shift. Go watch that video. 4. The nurse employed in a long-term care facility is planning assignment for the client on a nursing unit. The nurse needs to assign 4 clients and has a licensed practical nurse and 3 assistive personnel. On a nursing team, which client would the nurse most appropriately assign to the licensed practical nurse? This is very, very important. A very nice question. Okay? Now, you have 3 APs and 1 LPN. Going back to the job description, what do you think will be the right answer? A client who requires a bed bath. B, an older client requiring frequent ambulation. C, a client who requires early vital sign measurements. D, a client requiring abdominal wound irrigations and dressing changes every 3 hours. What's the right answer? The right answer is D. Back to our nursing, our responsibilities of an LPN and an UAP. We say the LPN can carry out sterile wound dressing, irrigation, colostomy, and so on and so forth. While the LP can do activities of daily living, bed bath, ambulation, vital signs, objective data checking, vital signs, right? So A, B, C are for the UAP, YD is for the LPN. Now, I want you to know something in this question. You might have a question where the registered nurse has just the LPN. In that case, the least possible option that you see should be assigned to the LPN. Let's say in this question, there was just the LPN. And the option there, you find A, let's say initial education. B says an older client requires frequent ambulation. C says first post of vital signs. And D says wound irrigation. Let's maintain wound irrigation. Frequent ambulation and wound irrigation are all the activities of the LPN. But in this case, you will choose the least possible activity because the AP is not here to take this action. I don't know if you understand what I'm trying to say. So you have to take care, you have to be careful when choosing your option. You will say, oh no, this one is for the UAP and this one is for, but there is no UAP in the body of the question. So go to the least option and the LPN should take care of that. And the registered nurse will take care of any other higher tax. Be careful. 5. The charge nurse is planning the assignment for the day. Which factors should the nurse remain mindful of when planning the assignment? Select all that apply. What did we say? Guidelines when delegating tasks. Can you remember? Guidelines. A says the acuity level of the clients. B, specific requests from the staff. C, the clustering of the rooms on the unit. D, the number of anticipated clients discharges. E, client needs and workers' needs abilities. Which is the right answer? The right answer is A and E. The acuity level of the clients. You have to understand the skills, the scope of practice, the job description, and link it to the tax. The tax that you want to delegate, is it equivalent to the job description of the client, of the nurse, or the LPN you want to assign? Client needs and workers' needs. Yes. client needs is very important. So we take it over again. We say, what do you do? Ensure the client safety, be aware of individual variation in work abilities, determine which tasks can be delegated and to whom, right? Validate delegatees' understanding of the directions. You have to be careful with that, okay? So A and E are some of the guidelines in delegation. Let's look at the last one. I wanted to, should I give this one for you to do it? And drop the answer in the comment section on the YouTube. Anyways, let's do it. While delegating to the UAP, the RN should utilize 5 rights of delegation. The right direction and communication related to the task is one of these rights. Yes. Which statement best meets that standard? Very nice. It's a good question. A, I need for you to take vital signs on all clients in room 1 to 10 this morning. B, Mr. Wu's blood pressure has been low. Please take these vital signs first and let me know if his systolic blood pressure is less than 100. C, Mrs. Jones fell out of bed during the night. Be sure you keep a close eye on her this shift. D, would you please make sure Mr. Gracia in bed 8 ambulance several times? Oh, do you get it? Give concise, specific, accurate instruction. The right answer is B. B is specific, right? Let me know if his blood pressure is less than this. C, be sure to keep a close eye. It's vague, okay? It's not specific. Close eye, what do you mean by that? D, ambulate several times. Several times, no, it should be specific, okay? That's it. I hope you learned something. Watch this video over and over and practice more questions, and I wish you the best. Thank you so much and stay blessed.